Megan Heidelberg with Your Carolina on a little field trip to Allure Medical. We're at the Greenville location today, right off Halton Road, and we grabbed Dr. Musin real fast as he's in between seeing patients. So much we could talk about, but today I want to pick your brain on vein disease. How common is that?
Extremely common.
Really?
A lot more so than people realize. About 1 out of 5 people in the United States have vein disease to some extent. Now, not all of them need treatment, but a lot of them do. And when you think about that, that's about 70 million people, and over 1 million just in South Carolina alone. So it's very, very common. Well,
what is it exactly, and how do you know if you have vein disease or if you just have some of the other stuff associated?
Sometimes it's hard to tell. The typical patient who comes in has aching, heaviness, tiredness in their legs, swelling, typically in the calves. Not usually severe pain. It's usually more of a dull, achy, heavy sort of feeling, and maybe fatigue. Sometimes they'll get odd symptoms that don't even seem circulation related, like leg cramps, restlessness. It might interfere with their sleep. So it can show up in a lot of different ways, and that's why it's sometimes a little difficult to diagnose. But the problem itself is basically just that the valves that regulate blood flow in the leg have worn out, and when patients stand, they are getting backflow of blood, and it puts more pressure on the legs, and that's where most of the discomfort and swelling comes from.
Oh, and what about the people that are like, I mean, it's a little annoying, but it's fine. I don't really need to do anything about it. What could happen if these symptoms go untreated?
So if the legs absolutely don't bother them, they're probably going to be fine. As I say, not everybody who has vein disease has symptoms or needs treatment. But if you're starting to see, for example, changes in your skin color or texture or open sores in the legs, and certainly if you're getting a lot of bulging veins, then it's something that does justify treatment.
Is there anything that specifically causes it? Like, I'm wearing high heels today. If I have these on all day, is that something that could lead to it?
Surprisingly, high heels and crossing the legs, a lot of things that have been blamed on this before, are not as much of a problem. It's largely genetic. So you're born with a tendency to either have the problem or not. And then there are triggers in your life. For women, mostly pregnancy. Men, it's injuries and sports like football. I see a lot of ex-football players that come in and their legs are involved. And then standing a lot. What I tell people is if you've got the family history, you've had children, and you stand in your job, those are the 3 strikes that you're almost guaranteed to have some vein disease.
Oh, great. All our nurse friends and teachers up here are like...
Teachers and nurses, by far.
Right? They're like, all right, we're coming to see you, Dr. Musin. But talk about, like, the treatments, and it's not, all bad. There's things that y'all can do, and everything can be okay.
Right. Traditionally, this was a surgical specialty, and in the past, patients would end up going through something called vein stripping. We don't do any of that. We don't do anything surgical. All of our treatments are done in the office. We have minimally invasive procedures, and all they're really aimed at is closing the veins that are not working right and rerouting the blood flow into healthy veins with good valves. And it's a very easy thing to do. So none of our treatments take more than about 10 minutes. There's no downtime afterwards. Patients can drive home, they can go back to work, they can walk, they can do all their normal activities with no downtime at all.
Do you need to be referred to come to you, or?
You do not.
Oh, okay.
There's one insurance company that we work with, TRICARE, that requires referral. Just about every other patients come in, they see our advertising, they come in and they say, please help me, and we do.
Okay, last one. This is more a vanity thing, because I know a lot of ladies are like, oh gosh, I got those veins, I don't like those, the veins how they look. Do you take care of that kind of stuff, or is it more for the pain?
Our top priority is pain.
Okay.
But we do consider the cosmetic aspects of it as well. And some of our patients come in for spider veins, but that's not really our big focus.
Okay.
The nice thing about the minimally invasive procedures compared to the older surgeries is they don't have scars all over their legs afterwards. And we really strive to make their legs look as good as they feel.
Okay, I love that. So listen, if any of these things apply to you at home, if you've been, having some restless legs at night or any of the numbing, you're like, all right, maybe it's time we go see if something's going on. Give them a call here. All the information right there on the screen. You've heard people coming in and out as we're doing the interview today.
We're busy.
It's a hopping place. So great location. Allure right here again off of Halton Road. We appreciate it, Doc.
Thank you.